Hello, I'm Dr. Marty Ross. In this video, see how Antabuse may be the new Lyme disease breakthrough antibiotic. Treat Lyme is supported by purchases you make through Marty Ross MD supplements.
Hello, Barris. Hey, Dr. Ross. Due to my wife's extreme fatigue, we were constantly looking for that silver bullet. I read some very recent articles on the use of Disulfiram Antabuse for the eradication of both Lyme bacteria and Babesia. Do you have any thoughts on this novel treatment? Is there any downside to trying Disulfiram for 3 to 4 months? All right. So Antabuse, I'll make some comments, okay? And what I'm going to say ultimately is we really don't know. It's too early to tell. That's my overview comment. But okay, so what is Disulfiram and Antabuse? All right. So Antabuse and the drug Disulfiram, which is Antabuse, all right, is something that we use for people that are alcoholics, actually. And that is because what it does is it is medicine that blocks an enzyme that leads to the breakdown of alcohol. And when this enzyme is blocked, people with that have alcohol build up high levels of something called acetaldehyde, which makes them feel very, very sick right away. Okay, all right. So it's an enzyme blocker and leads to the elevation of a chemical called acetaldehyde. All right, that's what we use it for in alcoholics. Okay. Now there's a researcher out of I believe he's still at Northeastern in Boston, a guy named Lewis that has done about 4 years ago, did some research on persister Lyme. He was one of the first researchers to show us on Petri dishes that Lyme, actually when it is exposed to ongoing antibiotics, has the ability to turn into what's called a persister state, okay? So what a persister is, and what his experiments from 3 or 4 years ago now showed us that that about 20% of Lyme spirochetes and about 20% of Lyme cyst, when exposed to ongoing antibiotics, have the ability to turn into these things called persisters. And essentially what a persister is a form of a germ that goes into hibernation, slows its metabolism way, way down, and just starts ignoring the antibiotics, okay? So this same guy has been looking at other ways to treat persisters. And he's done some experiments and done some studies looking at various chemicals and whether they might have the ability in lab experiments to help treat persisters. And he identified one potential medicine being the Antabuse. Okay, all right. Now, based on that, one of my colleagues, a guy named Ken Liegner, Dr. Liegner, who practices out on the East Coast, decided to try, I think maybe about 3 patients. He reported that he's had success in helping people that were having difficulties getting over Lyme by putting them on Antabuse. There were some good improvements, okay? Now, one of the things that he has found in his practice is that it takes about 4 months. And again, it's in a small number of people, so I can't say whether this is going to be generalizable to everyone with Lyme disease, okay? All right. I know that another one of my colleagues that practices in Colorado, a guy named Daniel Kindler, Dr. Kindler, is reporting having tried this with some of his patients and having benefits as well too. But even he has said, in the writing I saw him do on this, that it's still too early to really tell, although he's holding out promise for this, okay? So what Dr. Lewis's research tells us is that one way that or one of the things that the Disulfiram Antabuse can do is treat persisters, okay? There may be some ability for it to help with Babesia. It does have some action against parasites. And Dr. Kindler says he may be seeing some benefit with Bartonella with it as well too, although he's not sure about that, okay? So is this the magic bullet? I think it's way too early to tell. I have been here many times before where a treatment was developed, like using Dapsone, for instance, that Dr. Horowitz came up with a number of years ago. It helps some people, but it is not the magic bullet for everyone. This one has got my attention. And I think we're just going to have to see whether using Antabuse is going to be something that's going to help everyone Or is it just that there was something unique about Dr. Liegner's patients that those few patients he tried on this had benefit? Okay? All right. So that's the best I can say at this point. Is there any downside to using it? I mean, you can't drink alcohol when you're on it, so you have to watch what you're taking and limit those things that have alcohol. Beyond that, you have to do some liver studies periodically, make sure your liver is handling it okay. But beyond that, I don't see any downsides to using it. If you do use it, you have to realize it's considered to be kind of an experimental treatment at this time. Okay? All right. Thanks for that question, Barry.